Hi, it's Jenny B, NSWC. Today I want to talk about incisional VAC and how that actually relates to Pravina. I actually have had a great question from a nurse about how do you actually get surgeons to buy into using a Pravina as one of their primary dressings post-operatively. Well, again, as I've discussed prior, is that again I want to use it on any suture line that there's a lot of tension on and that we're concerned about dehiscence or seroma development or even hematoma development if there's a lot of trauma. So I've worked with two surgeons and they're really on the opposite ends of the spectrum. One is MacGyver that, I give him a spiral foam and he can vac just about anything. I've seen him make an apthera out of it. Like he really loves the new technology and utilizes it in his practice as often as he can. Then I have this other guy who's a little old man trapped inside of a young man's body who hates change and doesn't want to do new things oh, what's that fan-handled contraption that you've got? Until you can actually show him how it works, why it works, and the benefits of using it. So one of the ways that I was able to kind of get that buy-in with, the little old man that's trapped in there that hates change was by doing an incisional VAC. That's putting on the VAC, or basically a Pravina, after the fact. So one of the things I want to note is the Pravinas, they're about 3 inches wide. And the reason that this is like this is that actually you need this much of the foam to actually get contraction down so that you're actually penetrating the depth of the incision so that negative pressure is beneficial on it. So that's very important to note because in incisional VAC, traditionally most nurses are just using the 1 inch that comes in the spiral foam package along the incision, but it's really not enough pressure. It's only going to be penetrating down about this far. So again, we do want to get a little bit wider because again, when you're just using this small skinny piece for incisional VAC versus our larger thicker piece, you're not getting as much pressure on the incision line. So I'm just going to show you how I've made a little model. I'm going to show you how that we're going to do the incisional VAC. So this could be somewhere on an abdomen, could be on a hip or a knee, or somewhere, again, even on a C-section. Those are really the most common areas that I end up using it. It does work really well in a sternum. It's one of the first things we use them for, but again, we're going to start with these are kind of your more common areas that you're going to see this and that you can apply that incisional VAC and you can show the physician, well, I started seeing increased drainage. We thought there was seroma formation and seeing what that negative pressure really does to prevent dehiscence of the incision. So for the most part, you're going to be doing this in a sterile environment. I'm not going to get all garbed up for this, but I just want to show you how it works along the incision line. So it's still, for the most part, I'm going to use a medium spiral foam. Sometimes if the incisions are smaller, you can use the small, but for the most part, this is the one I'm going to stick to. The reason I like it too is that because the spiral foam all unravels, and then you're able to make that 3 inch wide piece of foam that we're going to put right along the incision line. I still am pretty big on using this to put underneath the track pad so that we get good suction and there's foam underneath the entire track pad so we don't have any pressure. So I do take the drape out. This is kind of the one times I use the nice little pre-cut ones when I'm not using them for a bridge. And again, with the VAC, you still want to protect the peri-wound skin. It really is the primary goal when you're doing a VAC, because if you don't protect that skin, you'll actually end up eroding it. So what I do is I always cut these in half and keep the strips there so that I'm doing some good skin protecting. The other big piece that we're going to be using is something called Adaptic. Adaptic is a product made by the same company that is fenestrated contact layer is basically what it is. So there's small little holes in it, and it's really used as a non-adherent. If you don't have Adaptic, you usually have something very close to it, something like Bactiguard or Gelonat. For the most part, the company usually promotes to use Adaptic, but if you don't have any other non-contact layer is usually super helpful, because again, we don't want anything to come in contact with our staples, or sutures, depending on what you have in the incision. So to do this, first off, I'm going to again protect that peri-wound skin. So I always take off the white, and then I'm going to put it pretty close to the incision line. I'm going to have the drape not on any of the exposed skin or on the incision line, but very, very close to it. Now this is a sponge. We'll see how good it ends up working. So I'm going to put it down along both sides again, because I'm going to protect that peri-wound skin, and I'm not going to allow for anything to be exposed. So what I'll end up doing is using the other pieces on the top and the bottom. So I can cover it over like this. So if you're worried about it sticking, I'm going to show you a couple tricks. One is, if you actually pull off the green layer and you do have a little extra, instead of just flopping it over, you can actually cut this quite easily just on its own. It doesn't stick as much to the scissors when you don't have that other green piece on, and then you can get it there. Now, if you do have some incision left, you can just cut down and pull some of that off instead of having to do multiple strips. And it does tear fairly easily. So I'm going to do one at the top as well. So again, so all my peri-wound skin is protected. Again, if I have a little extra, I just cut it off. So I've got a nice little window frame of my incision. I need that window frame so that, again, that negative pressure can come in contact with the skin. So again, I would normally be sterile, and often I actually end up with the track pad at the bottom. So if I needed more drape, I would put more down at the bottom so that, again, I'm not causing any damage to the skin. But for the most part, I'm going to go up the incision. If I want, I can move that to the side, put another one to go down. Hopefully I wouldn't have my hair in this either. This is just for viewing. And then I'd go up again with the third piece. So I'm getting that 3 inches. Then I just tear. And again, same as I do with my bridge technique, I try to just apply the foam directly to the bandage. So I'll even lay it down on my sterile field to start it. So I'll lay it this way. So I have my 3 pieces wide, and I can lay them right in there, and then I have better control when I'm placing it. So I can put the whole thing on too. So the whole thing is sticky. So I have that ready. The reason I do that, because I want that ready, is because I am also going to lay a piece of adaptic over the incision. Now I usually cut it to fit whatever the incision size is, so that again, that I'm also protecting that skin underneath. On the back of her vena, there's a white piece that this is already built in to the prevena, which is why you don't need to use it when they're putting it on a surgical site. But when you're doing just an incision line, we do want to place a large piece of adaptic on it. Then, because I've got my sticky stuff already, I can literally just place it on. And tack it down. And then I will add my track pad to the base. So an incisional VAC doesn't need to stay on and be changed every 48 hours. The Prevenas, we do know, can stay on up to 7 days. So again, I'll cut this off, and then I would apply my track pad, so in whichever direction it works best for the patient. So again, when we're applying the suction to this, again, that's going to draw down onto the incision and remove any excess fluid. There's multiple attachments depending on how much drainage that you're having out of this, but you will really notice a huge difference within a short period of time. And again, that's how I'm able to get the surgeon to buy in, because when they see the difference, especially, you know, we're really great at taking photos for each other and saying, you know, I've got 3 abdominal pads completely full of fluid, I'm going to put an incisional VAC on, and then you go back in and you can actually quantify on the VAC that there's, 100 mils out versus, the amount that was in the abdominal pads. Now, if you ever do need to quantify, we'll tell you that fluid is the same as weight. So 1 gram of fluid is the same as 1 mil of fluid is still the same as 1 gram. So I've actually taken pads over to the OB section and weighed them on a baby scale to say, so these weigh 350 grams. So I know there's like 350 mils coming out that, that can give that alarm and quantify it for the surgeon. So because you can say a lot or large amount, but again, it doesn't quantify. So it's another great tip, so that again, if you're trying to get that buy-in, that's one of them. So I'd put on a lot of incisional VACs just to show him that that it can make a difference. So if you're having trouble with that buy-in for the Prevena, again, it's also providing that education, saying, hey, try my other toy because this works really, really well too. So that's how you do complete an incisional VAC. Hopefully that's helped, and hopefully you got some tips. Any other questions, let me know, and don't forget, best wound is a closed one.